Frequent bathroom breaks can be a sign of a urinary tract infection, sometimes just called a UTI.
Urinary tract infections are infections in the urinary tract, in the bladder, which can spread up to the kidney. And the symptoms of a urinary tract infection can be frequent urination, urge to urinate, burning, and rarely some fever. Some people might have pain in their belly, and they weren't sure what it is.
Given the nature and the function of your urinary system, you'd think there'd be a lot of infection-causing bacteria floating around in there. But in reality, urine is pretty sterile and usually bacteria-free. The most common UTI infections occur when bacteria travel from the bowel, where there are a lot of bacteria, up through the urethra and then bind to the wall of the bladder. Typically, the wall of the bladder is coated with certain proteins that keep the bad bacteria from binding to the wall. This prevents the bacteria from growing and also makes it easier for the body to clear them out while going to the bathroom. It's only when the number of bad bacteria start to outnumber the body's natural defenses that an infection can occur. Now, the bowels are in no way connected to the urethra. Those two systems, completely separate. The only area of the body where these systems are likely to interact are their exits, which is why poor toilet hygiene is a common factor in UTIs. And females, whose urethras are simply shorter and closer to the bowels than men, are more physiologically likely to suffer from urinary tract infections.
A urinary tract infection in a man, there's something structurally wrong that causes this problem and needs to be evaluated to help prevent it. An infection in a man can turn very serious very quickly, so it's something that you want to get evaluated.
If you suspect you have a urinary tract infection, it's important to have it evaluated by a physician. The typical UTI symptoms, the bloating, the pain, the constant urge to urinate, are also symptoms associated with more serious conditions like kidney stones, appendicitis, or diverticulitis. The doctor will run some tests like cultures or a urinalysis, which looks for white blood cells, to determine if there's an infection. Once the doctor diagnoses you, he'll start a treatment plan.
The most common way we treat urinary tract infections is with antibiotic therapy. And in most women, it's a very short course, a simple course of standard antibiotics, and it should go away. If we have someone with complicated infections or infections that don't go away, we might need to treat them with courses of antibiotics up to 6 weeks.
There are lots of things you can do to prevent urinary tract infections. Some studies show that 8 ounces of cranberry juice every day stops bacteria from holding onto the wall of the bladder. Other easy preventative rituals are to practice good toilet hygiene and to urinate after sexual intercourse. I'm Dr. Keller Wortham, and you're watching the eHealth Network. See you next time.